Okay, I have a new guest today. I'm here with Ellen Grover, who's a physical therapist and also owns her own center in Portland, Oregon. There's tons of letters behind her title, so I'm going to let her tell you what they all mean. But Ellen, thank you so much for joining me. And I'm so excited to ask you so many questions because I have a lot for you.
Well, thanks so much for asking me. And yeah, I've been a therapist for 32 years. And one of my certifications is OCS, which means Board Certified in Orthopedics. And I got that in 1996. And I have renewed that certification every 10 years. And then another one that I have is I'm a certified McKenzie therapist, which I became in 2016. And I also have my master's in public health. And I got that because it just really fits with what I care about as a therapist. Just public health and people's health in general is really important, and just kind of widens the scope of being able to treat people. So
Cool.
yeah.
I'm so glad you're here. And for those of you guys watching, Ellen wasn't actually my physical therapist, but she works really closely with Dr. Gelman, who's the orthopedic surgeon who I had a different interview with. So go check that out if you haven't already. But I'm just going to jump right in. So a lot of these questions come from myself because I just remember what it's like to be in those early stages where you're actually in physical therapy or preparing to start. And then a lot of these questions also come from people who have sent me questions over the years. So the first thing is I've broken my ankle, I've had the surgery, I finally get clearance to come to physical therapy. Given that everybody's different, obviously, and everyone has different healing times, like what are some basic things that people can expect when they come to you for the first time, like just starting out after an ankle surgery?
So the first time you come in, we just need to take a look at the site. So we'll have you, if you have a boot on, we'll have you take your boot off. We want to see what your swelling looks like. We want to see what your skin color looks like. Want to get a sense of how is the foot, ankle, leg moving? How much muscle atrophy do you have? What does your calf look like? What does your thigh look like? And just how are you doing in general? How are you feeling about it? Are you having pain? There's a lot of things that go into, and how are you getting around? What's your status? If you're weight bearing, if you're non-weight bearing, how are you managing the condition, and what can we do to help you to manage the condition?
And so say like for me, I was non-weight bearing. I still had several weeks left. Or maybe, yeah, maybe it was like 2 or 3 weeks. I can't remember. Before I started weight bearing. And I remember like we spent sort of half of the time with like massage and trying to like loosen up the tissue, and then half of the time doing like these little exercises, and then a couple minutes every day on the recumbent bike, just like moving. Is there sort of like a general formula that one can expect if they're non-weight bearing when by the time they come to you, that like you're looking like, what are your main goals for those first few times for yourself and for the patient?
So I would say the first few times, if you're non-weight bearing, the goals are range of motion and swelling control. So we're really looking at the mobility. And I happen to have
Yes.
an ankle here. And you see how many bones there are in the foot and the ankle. And so you want to be sure that all of these are moving. Just because you didn't break one particular part, you want to, so I would say range of motion and swelling control, they go really well together, because if you don't control your swelling, you're not going to be able to get the mobility. So you want to make sure you're doing edema management, and then you really want to be working on your motion. And if you're non-weight bearing, you also want to be working on your strength, the exercises you can do non-weight bearing, strength of your hip, strength of your quad, strength of your core. There's things that you can be doing that are going to be very safe for your leg, but that are going to give you an advantage when you do start weight bearing.
That's key. And I remember there was this awesome boot that my physical therapist put on me that was like icy, and it had like sloshy, icy compression. It was so good. And it felt like such a good supplement to all of the icing and elevating and all of the crazy stuff I was constantly doing at home too.
So it's just a great way to help you manage after you've done some exercise, or if the therapist has done some. So you do the soft tissue, but you also do mobilization. So you're helping to move the joints. And, but sometimes that can make you a little bit sore, or after you can get a little bit swollen. So that's a time, like in PT or at home, that you can do some ice and compression. And it's kind of the thing that the slushy thing you're talking about. Just because, like we said, that edema control is a really important feature of sort of managing your condition when you're in that non-weight bearing. And it's expected that you're going to have swelling. So swelling is normal, but it's just kind of monitoring how it's doing. And that's where, when you come in on the first visit, we'll take a figure 8 measurement of the swelling, and then we can monitor it each time to see that it's not getting worse or that it's getting a little better. That's one way to also just kind of track it.
So you mentioned range of motion. Obviously, like if we're just going to physical therapy once or twice or even 3 times a week, there's still all those other days that if you're non-weight bearing like me, you were just like lying around in bed. What are like some key things, and maybe your model will be helpful, like that we can be doing to increase range of motion, just like on our own? What are some basic foundational things?
Right. So I think the first thing is just being aware of all the ways that your foot and ankle move. So everyone pretty much knows that you do ankle pumps. Your foot, you go up and down. So I mean, that's a basic. You do that for range of motion, but you also do that for swelling control, because you create a pump when you contract your muscles. But then you look down, and so you can do that actively. So you can bring your ankle up and down on your own, which is the ankle pumps, or you could do it with some light assistance. So you could take a belt and you could gently be pulling that up while you're doing that. You're always doing that to your pain tolerance. But then you got to take a look at the rest of what your ankle and foot is attached to. So you've got the up and down, then you've also got your subtalar joint, and that's your ability of your foot to turn in and out. So you want to be able to bring your foot in, you want to be able to bring it out, and you can use your hand to give a little bit of overpressure in both directions. Sometimes people want to say like, oh shit, can I do ankle circles? Of course you can do ankle circles, but I usually recommend that you work. I always think that in rehab, it's all about gaining the basics. So the basics are your ankle needs to move up and down. It needs to move side to side. And then if you can do all of those things, you're going to make a really nice circle. But if you can't do those things, it's fine to try the circle, but it's not going to turn out very, very well. So really working on those basics. Then looking down in your midfoot, all these bones in here that move, you can take your hand and you can just gently move them around. And lots of times when you've had a trauma to your leg, your foot, your ankle, your toes get really tight, and your toes get.
My toes got so tight.
Yes, they get so tight because you're not weight bearing on them. You're not walking. You're not getting that motion in your toes. I have had people that, they don't want to move their toes, but then they start walking and actually their ankle doesn't hurt at all. Their toe hurts. So it's just really important to be stretching your toes and moving your toes, moving your midfoot. Motion, when you talk about range of motion, it's the whole thing. You don't want to just focus on the one area that's injured. You want to focus sort of on the more global foot and ankle. And your knee too, because your knee can be involved. Your hip could be tight. You want to look at the whole chain. That's really important.
You know what's crazy is 8 years later, my toes still get tight. Like I have like little, I think I healed really well. And I have been on the healing journey where I've had, setbacks and like occasional weird tightness and pains in weird places, but the toes, like I still sometimes have to do that thing where I sort of like sit on my heels with my toes like bent over. And I use toe spreaders sometimes because for whatever reason during that healing process, like the toes just didn't fully give in the way that they probably should have.
Well, and I mean, the good news is it's something that you can always keep working on. You can gain more mobility in a joint or a muscle if you work on it. it can get better, even if it's been a long time.
Yeah.
But from a proactive standpoint, when you're non-weight bearing and you don't have a lot to do, that's a good time to work your active motion, like you said, work your passive motion, just kind of playing around with that while you're usually watching Netflix or something.
Right. I watched much Netflix. So you also you mentioned the muscle atrophy, which I was not prepared for, and I think most people are not prepared for. I remember the first time I looked down at my calves, like next to each other, and I was like horrified. Do you think when it comes to like calf atrophy, how can you even work that before you start weight bearing?
So you can. You're not going to build the calf enough. I mean, you can get started. So when someone has lost their calf and they look at it, so usually we'll take a couple measurements of the calf. We'll compare when they, and that's another thing we do on an initial visit. So we're taking our measurement of your swelling. I'm taking measurement of your calf. I'm also taking measurement of your quad, because the quad often will atrophy as well. So we'll measure the quad, we'll measure the calf. And then when we look at the calf, we'll compare what the other size of the calf is. And then I always call it that one of the things you're going to be doing is the quest for the calf, because you're trying to find it. And so, yes, you can start working on it, because active range of motion is engaging the muscle.
Yeah.
Even lying on your stomach and plantar flexing or pointing your foot, well, gravity matters. So even just doing something against gravity, technically that's more resistance than lying on your back and bringing your foot up and down. Then depending on your status, you can do some seated exercise. You can start using a band. You can do, I kind of call pre-calf raises, where you're just sitting, you put your feet on the ground. Once you're at that stage, that's acceptable, then you can start doing some seated calf raises. So all that matters, because it's also stimulating the calf. The other thing you can do that research has shown is you can work your other calf. You can work your other calf harder. So if you're doing like single leg calf raises on your uninvolved side, your studies have shown that overflow, if you do hard effort, is actually making that muscle on the other side contract. So people are always like, well, I know I'm working my other leg because I'm not weight bearing and I'm, but you actually can have some benefit to that calf just by working the other one. So there's a lot of different things you can be doing before you can get super aggressive in your calf strengthening.
I did not know those things when I had my calf issues. So, oh well, it all evened out in the end.
But it's a good way to kind of get a jump start on it, so that you're going to have the calf is going to take a while to build back, and that's just the way it is. But I got to say, one of the most fun things is usually we'll do a reeval like once a month, and I like to get out the tape measure and say like, and sometimes you're gaining strength and you're not gaining girth in the muscles. So sometimes people come in after like 1 week, they're like, measure my calf. I know it's, and because you can feel the calf contraction, the muscle is working. But I'm like, I don't want to measure it. It's not going to change in a week. Like the earliest it's going to change in size is 4 weeks, but usually 4 to 6 weeks. But you already know you're firing that muscle better. You can feel that it contracts when you point your toes, like it's happening. But then sort of building that girth and that sort of thickness of the calf, that takes a little bit longer, and you're not going to be able to build that up as much until you're truly weight bearing and walking and stuff like that.
That's a great segue. Let's talk about weight bearing.
Okay.
Because this is probably one of the most relevant questions, the most like frequent questions I get asked is like, when did you start? What did you feel? Did you have these aches and pains? Like, so let's just go through that. What are you looking for as far as timing, not in like weeks or days, but more like what signs in the body are you looking for that a person is ready to start weight bearing?
So, I mean, I would say firstly, I'm always looking for the x-ray that they've had recently from their physician to determine that it's an appropriate time to start weight bearing. And I always follow that, because that is definitely a scientific, guarantee that you are ready to go. And so if they've had a recent physician visit and they say, my x-ray looks good, they say I can start weight bearing, then it's really, we talk a lot about load. So you haven't been loading this joint, the muscles, and I'm looking for how you're feeling when you get started. And I always tell people, if you're having some mild discomfort, that's fine. That's to be expected. You haven't been doing that. If you're getting a sharp pain, you're putting too much weight on it. You need to back off. Or if you do the activity and you sit down and you say, oh, I feel a little bit sore, like it's hurting me, that's fine. But if 3 hours later you're saying, this is still really hurting, this is bothering me, you've done too much. It doesn't mean you've damaged it and you're doomed. It just means that you got to back off. And next time you do it, you're going to have to work. So we really work with, it's better to start a little bit slower. And, we often use a scale just to get a sense. Like the first time you're weight bearing, I actually have people stand on 2 scales because then you can switch over. We have the old fashioned, that just have the little dial. So you have your weight and then you just get a sense and you go, how much do you feel comfortable putting on your foot? And they'll say, okay, that's 30 pounds. That's where we're at today. You're going to feel that, get that feeling. And when you walk with, say, your crutches, just put that amount of weight that you put on when you were standing on the scale. And then maybe you come back, 4 or 5 days later and like, I feel better. I think I can put more weight on it. Let's go to the scale. Let's actually get an objective number here of what you're thinking. And all of a sudden it's 60 pounds. We kind of can track that somewhat objectively. And also you're tracking it subjectively. How do I feel? What am I doing? That kind of thing.
That's cool. I didn't have the scale approach. What we did is it seemed pretty not formulaic in the sense of like not catered to me, but like we started with the 2 crutches and the boot and a sneaker. Then when I felt good there, we dropped a crutch. Then when I felt good there, we dropped another crutch. Like, can you talk about, is that a standard progression? Like then the boot comes off, the crutches come back, then you,
yes,
that's pretty standard.
That is a very standard progression. And I think that you usually can decide so you start with the 2 crutches and however much weight. And there's a point when if you're taking a significant amount of weight in the 2 crutches, then it's pretty clear you're ready to go to the 1 crutch. Right. And so that's how you can gauge that progression to the 1 crutch. And then you're full weight bearing without the crutches in the boots. And you're really building up your stability and your ability of your leg to take weight, but it's very protected in the boot. And then it's like, okay, we don't want to stay in the boot too long because you want to start, using that functional range of motion for walking. But then when you do that, you're going to be a little bit more sore. So, okay, yes, like you're saying, you take the boot off, go back to your crutches, work on that gait pattern, work that out, walk slower, don't walk so fast, because what happens is when you've been in the boot and you're feeling good and you're full weight bearing, you can move. Yeah. You're going, you're so happy, you can go so much faster. Then you take your boot off, you got your 2 crutches and you got to slow down.
Yeah.
So that's always hard, but it's much better.
But it's also such a relief to be out of the boot. Like when you can actually feel your foot like go like this on the ground. I just remember feeling so ecstatic about that.
And and when you're ready to do that, it's so much better because then I say every step is a range of motion activity,
right?
And you're working on that functional strength exactly how you want it to go. So kind of getting that balance between when it's time to come. But lots of times, and I'm sure you did this as well, like maybe you're in your shoe in your house.
Yeah.
Walking around when you're going to go out, like we used to do in our old lives, you would wear a boot. You're going to be around a lot of people. You're going to be on your feet for a long time. May not be appropriate yet to just have your shoe and your crutches. You might be more problematic. So you can have a little bit of flexibility in as you transition. Are you only inside right now? And then you move to outside, or you might use 1 crutch outside only, and you don't need the crutch for indoor kind of distances and things like that.
Yeah, exactly. And I got a lot of questions too, like do I sleep with the boot? Do I wear the boot inside the house? Like, and my answer is always like, I didn't, inside the house, I was just in a sock, basically, like while I was still non-weight bearing, because it was so uncomfortable. And as soon as I went out, I strapped up, I got the, like, but being in the house, when you have control over your little environment, it's nice to like take a break.
It's nice to take a break, and it makes it easier for you to be able to move your foot and your ankle and your
Yeah.
toes and all that. But you want to be safe. I mean, it depends on your home environment and who might be running into your
At
foot.
that point, I did not have a 6-year-old, so that it was much safer.
Lots of, if you have, I mean, I have people, you know, their kids think that's a great place to hang or something. You know, so you gotta gauge your environment as to when that is the smart move or not.
This is also $1 million question.
Okay.
Limping. My physical therapist told me, because I'm like, what if I have a limp? Like, you know, and I get that question all the time. What if I'm starting to walk? What if I have a limp? And she's like, if you have a limp, don't have a limp. You're going too fast. Like, you need to go take it back to the next phase. Can you add any context or flavor to that? Because it's a question that a lot of people have.
Yeah, I agree with your therapist, and I would say there's a couple of things that you want to think about. So if you want to learn how to do something, you don't want to learn it the wrong way. And when you're a new walker after your injury, you don't want to learn it the wrong way. And that's why you don't want to limp. And so, first of all, if you can walk with one crutch and walk well with the heel toe gait and not coming off that leg too quickly, then that's what, and then you think, well, I can walk without the crutch, but I limp and I, you know, and is that how you want to walk? Or, you know, you're training. It's like if you want to hit a baseball, you know where you want to hit it and you want to do it correctly. You're training to walk. That's your training. And if you want to do it correctly, you've got to use enough assistance so that you're not limping. Plus, if you're putting weight on your leg correctly, you're engaging the muscles and you're building them up in a good way, as opposed to teaching them some kind of substitution trick. I'm a big fan also of going really slowly to begin with, which I mentioned earlier, and is sometimes, I know, annoying. Because if you go slower, you have a little more focus on what you're doing. And lots of times I'll have people go forwards and then I'll have them go backwards, because you need to be able to, you know, kind of take that weight in both directions. And I always say, listen, if you can walk well slowly, you'll get faster, you know. But if you've learned this pattern, then it's so much harder to break it. And so I had a patient once who was a piano teacher, and they told me, if you learn this, like if you learn it wrong, then there's like a specific number of times you have to replay that piece over and over to actually get that motor memory to do it correctly. And you can think about that with your gait. You know, why would you want to learn it wrong? So yeah, just slow down and use whatever assistive device or whatever you need to be able to do it well.
Yeah. I have a weird specific question about, well, like I went on a hike shortly after I not started weight bearing, but shortly after I started feeling good weight bearing. Like I wasn't on any crutches anymore. And I was like, I felt pretty confident in my walk, but there was still this lingering thing for a while where I remember I could feel every little like divot in the ground, and I felt like I had no like shock absorbers left in my feet. Mm-hmm. What's going on there? And like it just disappears. Like it gets better when I guess you keep walking, but is it just weak muscles, or like what is that you start to feel every little like ugh?
So normally when we're walking, we're creating load, and you're creating some thickening, and also you just get used to, you know, kind of these motions of how the foot moves a little bit like you would on a trail. But it's just you know, and a lot of times people have some pain in their heel too. Yeah. But it's just because it stops loading. So it's your body thinks, oh, I don't need to protect this. I don't need to have a little cushion, or I don't need any thickness in this area because I'm not using it. So it's a basically just getting that sort of toughness in your skin back, and not just your skin, but on the surfaces underneath. So in the heel, it's often, I have a lot of people that have pain in their heel because you're not loading, and that fat pad gets a little thinner. And we talk all the time about, well, can't we just take that fat from somewhere else and put it in our heel? Like, gosh, and that's not how it works. But we definitely, it's just that whole kind of theory again about graded loading. And as you start putting more pressure, your structures will respond. So some of it is strength, and some of it is just the toughness of the tissue. The other thing is that, and I'm sure you did this as well, but it doesn't prepare you exactly for the trail. But like when you're doing your therapy and you're working on, say you're advancing, you're doing single leg balance, you're doing higher level activities, often then we'll progress to, a foam, a Bosu ball, a disc. Those are all things that will start working those pieces of your foot. It's never going to be exactly the same as the trail because training is specific, which is why you don't limp when you walk. But that's a way to start. That's another way to sort of help your foot and the tender parts get better.
Yeah, that makes sense. I didn't think about, like, it's sort of similar to the calf atrophy or whatever. It's like if you're not using it, you're losing it basically.
You are, and the body is very smart. It wants to conserve energy. So if it's like keeping some thickness in a foot that's not being used, it's
Yeah, they're like, bye.
not going to do it.
Yeah.
Why should I waste that energy? I'm an efficient system, and I'm not going to keep something working that I'm not using right now. And that's kind of what the body does.
We talked about this as we were sort of preparing for this interview, but I got to a certain place in my physical therapy that I felt like, because I've sort of had chronic pain my whole life, I felt like there was a lot of other stuff that I had either put on hold paying attention to, like weird back and neck stuff, because I was so hyper focused on my ankle, or like you said, like your ankle doesn't just affect your ankle, it affects your knee, your hip, your whatever. And so I got to a certain point where I felt like I needed more like training, not training, but like I needed to go to somebody who would be more of a like a holistic educator and like trainer for my body. When do you recommend people stop doing physical therapy? Like, when are you like, okay, I think you don't need me anymore? Mm-hmm. And or like, what do you recommend that people do in parallel with physical therapy, like other modalities or whatever, that might help address some of the stuff that physical therapy might not address?
Mm-hmm. So yeah, the first question about, when to stop physical therapy, I think that's very individual specific. So people have different goals because they had a different, sort of baseline activity level before the injury. So if so usually, that's certainly something we establish initially anyway, is like, what do you want to, what are your goals? What do you want to be able to do? What was your normal function before this happened? I mean, one of my favorite patients came in and he was like, lying there, non-weight bearing, had his ankle up in the air, and, and I said to him, so what are your goals for PT? What do you want to be able to do when you're done? And he said, I want to be able to run. And his wife was like, you've never run in your life,
Yeah.
And I was like, okay, so, that's a nice goal and that's fine, but that may not be our end PT goal because you weren't doing that before this happened. Right. So, maybe that's something you can work on when you're done with PT, but like, let's get you at least back to what your normal activity level was before. So, I mean, some people were runners or walkers or climbers or whatever before. And so we kind of look at like, do you have the basics of what you need to first of all, what were your goals for PT? Because people are different and have different goals. And second, do you have adequate range of motion? Do you have adequate strength? Do you have what I would call kind of like the basic lower extremity basics to be able to function at the level you want to? And then we certainly have a lot of people that want to return to running. And I would say they probably don't leave PT until they've run on our treadmill and demonstrated, but then at that point, yeah, you maybe you want to do some additional training, you want to, whatever you need to, then you're done. I would say that the goals are a mutual agreement. Okay, what do you want to accomplish? Is it reasonable that that's what PT can do for you? And then when you've met it, and carry on with your life goals and what you want to do,
Right.
and utilize other professionals to help you with that. And yeah, I think as far as the question of what people can do along the way, I feel like people do things, different things, and they can be really helpful. Massage is, I think you and I talked about before, a really, I would say something that people utilize a lot and can be really helpful. Um, Controlling swelling, helping with range of motion, helping with other body parts that might get sore because you're favoring one side over the other. People do acupuncture. Those are, I would say, massage and acupuncture would be the two things that my patients probably pursue the most.
Do you, I'm just thinking about like that moment when you leave physical therapy. Do you think that um, most of your patients are thinking about this journey in the way that we should be thinking about it? Like I certainly did not expect that 8 years later, I would still like my ankle's feeling a little stuck right now, and I have an appointment with my chiropractor next week because he every once in a while he has to do a little adjustment on it. Like that was not on my radar that was going to be needed, or like if I don't stretch it or do yoga in any sort of consistent way, I feel my calf and my ankle and my toes.
Mhm.
Like what do you feel like we should be preparing ourselves for, given that everybody's different, of course, but like long term?
Right. I mean, I think long term, what you were looking at is if you achieve, which you should achieve, a status where you feel good about what you can do and what you want to be able to do, it's maintenance of everything, right? Like just like you need to maintain your fitness level and you need to maintain mobility in other parts of your body, that is also something that you want to do for your injured part as well. So
Right.
I think that it's a sort of, it's just a shift. Like, okay, you might need to keep stretching because maybe that joint's a little bit more prone to arthritis or things like that. But you can take pretty good care of it, but just acknowledging that, just like you brush your teeth every day because you like your teeth to be there and clean, and that's what you're going to do for your ankle. You're going to stretch it, you're going to work a little bit on strengthening, you're going to just take care of it so that it can continue to be the high functioning part that it is. So yeah, you might be a little bit more prone to feeling a little bit tight or limited, but that's what you're doing. You go see your chiropractor, you go see it, get a massage, you're but you have to do that sometimes for other body parts too.
Right.
So it's more about having this philosophy that I'm going to take care of my body. This is a part of my body, and I'm going to take the time to do those things because you're going to benefit in the end.
I like that way of thinking about it as just part of your general preservation and wellness, because the question I get a lot is like, when will I feel normal? And my response is always like, any day now. It's not, I feel totally normal in all the things that I need to do in life. I can do, like, no problem with my ankle. But I'm very, even just sitting here, like I'm very aware if I focus on it that like one ankle feels slightly different than the other in just the way that it like sits on the floor.
Mhm.
And so I think like when we break our ankles, we just want to know when normal comes. And I think that the way you just described it is like, okay, normal, it's never going to be just like the other ankle, but we need to take care of our bodies regardless. So like, just give it a little extra love while you're doing that.
Right. And it's a new normal because
Yeah.
it's not, you're right, it's not exactly the same as it was before, and you can't expect that to be that way, but that doesn't mean it's not going to be good.
Right.
But you have to just kind of, there is that sort of mental framework of looking at it and just accepting as it is.
Yeah.
It should be good. I mean, you don't want to settle for something that's not satisfactory, that doesn't function well, that doesn't do the things that you want to do. That those are all very reasonable goals, but the normal of the exact same, it can't be exactly the same.
Yeah, that's the truth. Cool. Well, we've come to the end. Thank you so much for taking the time. I mean, even though I already have been through this a long time ago, I learned a lot, and it's so nice to be able to get into those like very, very granular questions. And I'm so glad you had your little foot model there, because it's very helpful. So
I think it's very helpful. I think understanding what's happened and being able to understand what you're trying to get back really just puts you in the right mindset for getting better.
yeah, so thank you so much. And this was fun.
Yeah, thanks for having me.
Okay, bye.
Bye.